When I first started, I was a technical instructor working in the OT department, so I would work in vocational services, so woodwork, graphics, horticulture. But a couple of years ago, we were sort of asked to, we were given different job roles, and I was asked if I wanted to become an OT assistant with a view to possibly doing a degree. So I obviously accepted the opportunity, and so I'm now working as an OTA, work on mental health director at men's wards, and working with patients certainly in a more clinical way than what it was when I was a technical instructor. Rampton has been really good, really supportive. I've done an access to healthcare course which Rampton's funded, and then from passing that, I've got an interview coming up for to go to Sheffield Hallam University very soon, in a couple of weeks, and so hopefully if I get through the interview, I'll start the degree course next year to become a qualified OT. Certainly in my sort of career progression as it's gone sort of up to now at Rampton, I've really enjoyed kind of like looking at the work that you can do with the patients in a more clinical way. So how to do certain interventions with patients can really help them, but then sort of thinking on your feet and looking at maybe a different intervention could help a different patient. So it's something I've really enjoyed. It's been really good. I've started working with some AHPs, so there's qualified occupational therapists, there's other OTAs, and there's speech and language therapists working in my office, and it's allowed for a discussion of ideas and how I can personally go forward as an OTA. Plus the supervision has been really good. I'm always supervised by a qualified OT, and we can talk about different things that I can do with the patients, and any thoughts or queries that I've got with regards to working here.